Let's take you here now. The coronavirus pandemic is accelerating on the African continent. The continent has more than 210,000 cases and over 5,000 people have died from the virus. There's a concern that the healthcare system on the continent could be overwhelmed as cases keep rising. Leaders in the West African region met yesterday to discuss the fight against the deadly virus. We get an update in terms of key outcomes from that meeting. I'm joined from Abuja in Nigeria by Professor Stanley Okolo, a Director General at the West African Health Organization. A very good afternoon to you, Dr. Okolo. Thank you very much for joining us. Perhaps if we can start with the mandate and the work of the West African Health Organization.
Thank you very much for having me. First of all, is to say that the meeting was actually last week. The ministers.
It must be the freezing conditions that seem to have crept into our studio and impacting the connection, but I understand that he is back. Professor Okolo, are you still there?
I am with you. Can you hear me?
I can hear you loud and clear now. The first question, Professor Okolo, is what is the work of the West African Health Organization? We'll get into the meeting in a moment, but what is your mandate?
The West Africa Health Organization is the health institution of the Economic Community of West African States. It is a regional economic community, and West Africa is the only region that has an institution that is dedicated to health. And so our mandate, as set up by the heads of state and government, is to improve health issues, to champion the regional integration through health, and to collaborate and cooperate with anyone and all and sundry in terms of improving and promoting health within West Africa, within the 15 countries of ECOWAS.
You alluded to it a little bit earlier on. You held a meeting with the health ministers of the different countries in the region. If you can talk us through some of the salient points that came out.
The reason for the meeting was because the heads of states had met a month earlier and insisted that we should continue the regional approach, but they set up 3 ministerial coordinating committees, one on health, another one on finance, and the third one on transport and trade. So the ministerial coordinating committee on health met as part of the support to President Muhammadu Buhari of Nigeria, who was selected by his peers as the ECOWAS COVID-19 champion. So we reviewed the epidemiology regarding the COVID-19 pandemic in the region. We looked at what was the phase of transmission across our states. We looked at the strategies they were using in terms of testing. We reviewed the public health challenges, and we reviewed what we were doing in terms of supporting states, both in terms of public health and in terms of finance. We also looked at the impact of COVID-19 on non-COVID health issues. So maternal mortality, childhood immunization, HIV, TB, and all those areas in terms of ensuring that we'll have a regional integrated approach to COVID-19 issues. And finally, we talked about easing of lockdowns, because the economies have been are being impacted because of a lot of the social distancing and community lockdowns that we have across our region.
As you rightfully mentioned, 15 countries making up ECOWAS, and as we understand it, from the 11th of June, numbers as a region sitting at 46,433 cases in the region. In terms of testing capacity, is there enough capacity, and are you satisfied with the level of testing that has been conducted in the region?
It is variable in our region. We all have a target, including Africa CDC, continental target, that we should aim to start and look at about 1% of our population. When you think of that, for our population, we're looking at about 3.8 million. Now, at the moment, we are testing only about 500 to 600,000 tests where we are today. But remember, these are primary tests. Now, the challenges are there because of how can we get these tests? A lot of these tests are not a lot. Most of these tests are not manufactured in Africa. So we have to get these tests from abroad. We are now also ramping up testing sites. As at a month ago, we had only about 30 testing sites across the West Africa sub-region. Now we have up to 50 across the West Africa sub-region because people are utilizing.
I think we got the gist of it, but we do apologize. We've lost that connection. Professor Stanley Okolo is a Director General at the West African Health Organization.